Dear students, in the last class, we discussed about the different contraceptive devices. Today, I will explain you about another technique which is used to control the population, but it is not 100% contraceptive. It is a medical termination of pregnancy. Medical termination of pregnancy. Medical termination of pregnancy. Dear students, this is, although it is not a method to control the population, but most of the people, they go for this and it will reduce the population. It is also called MTP. MTP. MTP, in common words, we call it as abortion. Abortion. In common term, we call it as abortion. And there are different reasons for abortions. One is in India, unfortunately, it is mainly because of girl-child pregnancy. Whenever the child is a girl child in the embryo, in most of the cases, people, they go for removing of that particular child, and that is also one of the reason. And second one is while using contraceptives, if accidentally, if a pregnancy is conceived, then they go for this abortion. And when there is a rape case or some unwanted pregnancy, then also they go for this abortion. And there are different types of abortion, but the most safer one is abortion in first trimester. First trimester means it is in the month of first 3 months, abortion is safe, and many countries legalized abortion. In India, first trimester means 1 to 3 months. In India, abortion, MTP, was legalized in 1972. So until that period, it was considered as illegal program. So in India, MTP was legalized in 1971. And also, it is essential in cases where, for example, you know that I'm giving an example. In South Canara, there are a lot of cases of endosulfan, abnormal child development due to the effect of endosulfan. In such cases, according to the wish of the parents, if the growing child is having any problem, then they can go for abortion. Last 2-3 years back, there was one case in Mumbai. Both husband and wife, they were software engineers, and the child which is growing in the womb of the mother, they came to know that it is having a problem in the heart. There was a hole in the heart, and they went to court and for abortion, because late abortions are not permitted in India. and only 24-week abortions are permitted. Then the court was rejected it, and both husband and wife, if they are financially, if they are sound, so they have every rights to develop that particular child without abortion. So, like that, in extreme cases, government will permit abortions depending upon the conditions. Okay? Yeah. But there are certain problems. Now we'll study about problems related to abortion. What are the problems? First one, illegal abortions. There is every possibility of illegal abortions. Second one is misuse of amniocentesis. Amniocentesis. What is amniocentesis? Amniocentesis is determination of fetal sex. Fetal sex determination. Fetal sex determination before delivery. So there is every possibility of detection of this fetal sex, and it will cause a lot of problem, because if there is a female child, then they go to remove that particular child. And it is also dangerous to mother in later cases. That means abortion during second and third trimester. Abortion during second and third trimester may cause dangerous to mother also. So, now with this, let us see how many abortions are going on in India in a year. First, I will tell you about the world. 40 to 50 million abortions. 40 to 50 million abortions occurs in an year in the world. 40 to 50 million abortions occurs in the world. And it helps to decrease the population. It helps to decrease the population. It helps to decrease the population. Then advantages I already told you. Now with this, let us move to sexually transmitted diseases. Sexually transmitted diseases. They are also called STD. Dear students, These sexually transmitted diseases are also called STD. They come only due to sexual contact. They come only due to sexual contact, and there are following such diseases. Let us see. There are some diseases which are transferred from one person to another person only by sexual contact. They are also called venereal diseases. Venereal diseases. Venereal diseases. Or they are also called reproductive tract infection. Venereal diseases, or it is also called reproductive tract infection. Example for this type of disease, let us see. Gonorrhea. 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 Syphilis. Syphilis. And then genital herpes. Genital herpes. And then chlamydiasis. Chlamydiasis. Genital warts. Genital warts. Trichomoniasis. Hepatitis B. HIV causes AIDS. So you should remember all these names of those diseases. They are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, HIV. These are all the diseases, and I will give a brief account of some of the diseases. Gonorrhea is such a disease which comes by the sexual contact only, and there will be lesions or small wound that occurs in the reproductive tract in the earlier stages. Later, that pathogen, gonococcus, will enter into the reproductive tract and it will destroy the reproductive system. In syphilis also, it is very dangerous because in early stages, the itching sensation will be there in the reproductive tract, and thus later it will disappear and it will reappear after 6 months for 15 days, and that itching and burning sensation will be there for the person, and it will disappear after 15 days, and once again it will reappear after 20 years throughout the body, including mouth, inside the mouth. Also, we observe the small bubbles of these pathogens which are coming out in the form of pus. Herpes, this is genital herpes. It is another member of that virus, is close relatives of normal herpes. Then chlamydiasis, genital wart, trichomoniasis, hepatitis B. This is also dangerous because it spreads by sexual contact as well as blood contact. Because, however, we should know the HIV, it spreads in different modes. All of us know that. in all those methods, hepatitis B also spreads. So, hepatitis B is equally dangerous as that of HIV. By sexual contact, by transmission of the blood, by salivary contact, and by by the transplantation of the organs. So, because of this disease is also dangerous. Now, let us see how method of spreading, how it spreads. By sharing injections, needles, or injection needle, by sharing injection needles, and then surgical instruments, and then you may ask, nowadays people are using disposable needles, sir. Where is the possibility of this injection needle spreading? It is there in case of drug addiction, because there are certain drugs like heroin drug, which is very effective, and one person at a time can't take a large quantity of that drug. So, and also it's very costly. And what happens? Such people who are the addicts of such drug will gather at one particular place, and they inject nearly 50 to 60 people will inject that particular drug by one syringe. If anybody is having HIV, there is a possibility of spreading of this that particular disease to all those people. So this is also dangerous. And by transmission of blood, this is another reason, by transmission of blood. And from infected mother to fetus. From infected mother to fetus. From infected mother to fetus. So these are all the methods by which the disease has been transmitted. Then the symptoms of these diseases, sexually common symptoms of these STDs. Symptoms of STDs. The common symptoms of STDs are itching. Itching will be there in almost all the cases. Fluid discharge, yellow fluid. That is a pus. That is due to fighting of pathogen and our WBC. Slight pain will be there. Swelling of blood vessels. Slight pain. It is due to swelling of the blood vessels in the region of itching. And then swelling. And if they neglect the disease in earlier cases, if they won't go for the consultation of the doctor, then it may cause long-term effect will be pelvic inflammatory disease. Pelvic inflammatory disease. Swelling in the pelvic region. Pelvic inflammatory disease. Pelvic region, I think I explained it. So, there will be swelling in that particular region. And infertility. This is also another reason due to destruction of the prostate gland in male. And ectopic pregnancy. Ectopic pregnancy. What is this ectopic pregnancy? I will tell you later. Abortion. Abortion. Abortions. And then stillbirth. Stillbirth means death of the child during birth. Cancer of reproductive tract. Cancer of reproductive tract. Cancer of reproductive tract. So, dear students, these are all some of the dangerous symptoms, long-term symptoms. One is pelvic inflammatory disease. If there is inflammation of the pelvic region, then there is every possibility that the lady may not conceive. Then infertility, because some of the pathogens, they directly cause infection to the prostate gland, and in such cases what happens? The prostate gland will be degenerated, or it is unable to produce the fluid, and that fluid, prostate gland secretion carries an enzyme called cat spur. Remember, prostate gland secretion carries an enzyme called cat spur, and that is very much essential for sperm motility, for the movement of the sperm. If that enzyme is not there, that secretion is not there in the semen, even 150 million sperm is of no use, because they can't move. And abortions. Whenever there is a fungal infection or a slight infection, conceiving is very difficult. Then if it is STD, then in such cases, uterus will be damaged. So, there is every possibility of this abortion. Then stillbirth, the death of the child before birth. Then cancer that occurs due to the wide long-term exposure to the STDs. Then reproductive cancer of reproductive tract. These are all some of the important. And ectopic pregnancy. I told you, I will explain it later. You know that in female reproductive tract, normally the child will be conceived in this particular region. This is the spot, or here, or here. But in ectopic pregnancy, what happens? Instead of conceiving here, the sperm and egg, when they fuse, the embryo starts attaching here itself. Embryo starts attaching in the tube itself, and it will grow slightly up to 1 or 1.5 months. Then what happens? Lot of pain occurs, and it will rupture. So it occurs. There will be a rupturing of this particular tube occurs, and due to that, what happens? The there is internal bleeding starts, and it should be treated within 24 hours. Otherwise, there is a risk to the health of the mother also. So that is ectopic pregnancy. Once if this portion is lost, then the chance of conceiving is reduced to 50%, because then this side of ovary, it can't release the egg to oviduct because fallopian tube, because of the removal of the fallopian tube. Only from this side the egg will be released. So this is called ectopic pregnancy. Now let us move to the next part of this chapter. Okay. In this segment, we'll find out the reasons for infertility. Although our population is high in India, the people who are not able to produce the offspring, their percentage is also high. It may be due to modernized food habit, lifestyle, mental tension, and the work tension, stress. These are all the reasons why the infertility percentage is high. And I will continue this in my next video.